Sudden death among Indians. I'm going to describe the 13 causes which I've identified and the health risks. I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. It's worrying that there's a significant increase in the number of sudden deaths, more so among the young Indians. And what's the reason behind it? So there are lots of discussion whether it was the COVID vaccine. And I've just seen a paper from ICMR and All India Institute of Medical Sciences research that they haven't found any conclusive evidence that COVID vaccine is responsible for these sudden deaths. So let's start looking into these 13 causes. I know some of you must be thinking it's an unlucky number, but it's just turned out that there are 13 different causes which I've identified. So why is sudden death and why are the Indians more prone to metabolic conditions? For example, there are 100 million people with diabetes in this country, and the number of people with obesity is much higher than that. So that's worrying, and that's what I'm going to discuss about, which is one of the predominant reasons, but let's go into the details now. So the first cause is central obesity. If you see lots of Indians, they'll have a big paunch and then skinny legs. And that's a classic recipe to disaster. So that clearly tells me there's increasing visceral fat, that's fat around the intestines, and they've got very little muscle mass. So that makes them prone to heart attacks, strokes, and even cancers. So the easiest way to measure that is look at the waist circumference or the waist hip ratio. So that's point number one. The second characteristic of Indians, or why they develop this, is they may not be obese, they may not have a high body mass index, they may not look big like the Caucasians, they may look much slimmer, but then they're still prone to heart attacks, strokes, cancers, kidney problem, diabetes, because they fall into the category of thin fat or skinny fat. Again, they have more fat around the intestines, but the muscle mass is low. So they're also called sarcopenic obesity. They have excessive fat mass. So in my clinic, what I do is a body composition analysis, which clearly tells me, though the BMI or body mass index is normal, the fat percentage is high. So consistently, I've seen skinny people coming to my clinic for, say, diabetes or reducing the cardiovascular risk. What I find is fat percentage is very high. So that's the second reason. So keep watching. There are some interesting facts to come. The third reason is there's very high insulin resistance. And this is very classic for the Indian population, and probably it's all genetically, the Indians are more prone to high insulin resistance, which in turn causes all the metabolic problems. So insulin resistance, which lead to diabetes, which is the main killer. So high insulin resistance, that's the third point. The fourth point is high low density lipoprotein. Within the cholesterol, the bad cholesterol is high density lipoprotein, which is high. The prevalence is up to 21%. That's very, very high. So let's go to the good cholesterol, which is HDL, which is high density lipoprotein. And the low HDL, that means the good cholesterol, is low among the Indian population, and the prevalence is 67%. So 67% of the Indian population have low HDL, and that's not good enough. You can increase your HDL by increasing your exercise. But I'll come to that, what's happening with the Indian population. So the next point, the sixth point is early type 2 diabetes. That's really scary. I am seeing 10-year-old kids coming with their parents who both have diabetes. With type 2 diabetes, normally you would think when the kids have diabetes, it's type 1 diabetes. But then I'm seeing the parents bringing them, I don't see pediatric patients, but they bring them to say, look, my kid has got type 2 diabetes. And that's really scary. So there's increased prevalence of type 2 diabetes. So if you look at the epidemiology, it shows that people actually have a long duration of glucose intolerance. They have abnormal glucose metabolism, and then they go on to develop type 2 diabetes. So the HbA1c is 6.5 or the fasting glucose is high. So that means they have had some degree of problem for a long time, and then the diabetes is diagnosed by the doctor. So if your diagnosis of diabetes is at the age of 10 years, what would happen in another 10 years? That is when they're 20 years old, they've developed all the complications. So no wonder they're having sudden death, heart attack, strokes when they're 20 years, 25 years, because they've developed problems even as a kid. So if you go to a school, any school in an urban area these days, you'll find that the prevalence of obesity is significantly high. I'm not going to go into the details of why obesity is more prevalent among kids now, but that's one of the reasons. So childhood obesity contributes to heart attack, stroke, and sudden death in young adults. Now, the lifetime risk of diabetes is much lower in the Indian population. So Indian population is much prone to diabetes. Similarly, they're prone to kidney problem. So my practice has been in the UK for a long number of years, and it's still there. So when I go into a dialysis unit, you'll find that there's a significant proportion of Indians and South Asians like Pakistanis and Bangladeshis in the dialysis unit compared to the population in the community. So that means more Indians, Pakistanis, and Bangladeshis have got conditions like kidney failure, heart attack, and stroke, and so more are getting admitted, and that's why more people occupy the dialysis unit. And the ninth point is there's more inflammation. See, the obesity itself is an inflammatory condition. So that means the inflammatory markers are high. The highly sensitive CRP, that is C-reactive protein, is high. And it's actually 61%. 61% of the population do have high CRP. That means they have a high inflammation. So any other triggers can kickstart sudden death, heart attack, stroke. So inflammation is more common among Indians compared to the rest of the population on this earth. Then the 10th point is the cardiovascular disease risk. It strikes early, at least 10 years earlier than the rest of the population, that is the Caucasians. If you look at the Europeans, they may have heart attack when they are in their 40s or 50s, whereas the Indians have 10 years earlier, and that's really scary. So no wonder, because the Indians have got sudden death in the 20s and 30s, it's been highlighted in the newspapers and the news. But what we don't know is we are genetically programmed, and we do not correct the underlying disorders like the fact that we don't get ourselves checked properly, we don't exercise, we don't manage our low HDL and high LDL. We don't do any of those things. And there is a reason to it. Culturally, our food is high in carbohydrate. It's a rich diet. So, and then culturally, we are always used to feasting and fasting. If you go to any part of the country, compared to the rest of the world, like in US or UK or Canada, you'll find the number of festivals are very high in India. And then people also fast. So this feast and fast, feast and fast. And when you do this, no wonder you tend to accumulate more processed food. You have lots of sweets and savories. But then the fasting is actually not good enough. We fast so as to feast. It's not we are fasting to improve our health. Most of us fast to go and feast later on. So this particular culture makes us prone to cardiovascular diseases. Activity, more than half of the Indians are physically inactive. So that's inbuilt, and that has to be changed. And less than 10% engage in any recreational physical activity. So if you go into the diet, our diet is very carbohydrate rich, as I said. For example, in the north of the country, it's always puri and aloo parotha. So if you can see that it's potatoes and paratha, which is wheat, which is chapatis, which is again carbohydrate. So it's two carbohydrates. Whereas if you go to UK, for example, the meal may be a jacket potato. So the potato is the carbohydrate. You don't have another carbohydrate. You may have on top of it some beans, which is protein, or cheese, which again is protein and fat. So can you see that there's a mixture? Whereas here, it's carb, carb, carb. And the South Indians are no different. It's exactly the same. They have huge amount of rice and a sprinkle of vegetables. So protein is very less. So most of the food, more than 60% is carbohydrate. So we don't have a balanced meal. One, genetically, we are prone to metabolic problems. Two, we don't exercise. Our food is not right. Probably it was good 200 years ago when we were farming and we had no automobiles and we were walking and we were exercising. So all that was good. But now it's all changed. So as a country, we need to wake up. We don't want to be a sick society like the Western world. So Indians have to wake up. Hope I've been successful in passing on this message. And this should be seen by the young Indians, because I'm seeing more and more of people from the IT industry coming with heart attacks, strokes. This is compounded by stress. So it's important to seek advice from your doctor. Take care.